We're here today to shout out to the coalition government a big no to any intended cuts and co-payments to our precious health system. A health system that is the envy of the world and which was built on the principles of equity and social justice. What we are facing today is a foretaste of things to come under this appalling coalition government. We knew it would be bad, but now we are seeing just where this government wants to take us. And that is backwards. Backwards to the elitist system of the past, where only the rich could afford proper health care and the working poor died young. If the Abbott government has it its way, we will end up with a dysfunctional two-tiered system like the United States. And we just have to remember what happened when they tried to introduce Obamacare, a communist plot. So this is the thinking we've got to think about. This must never happen here. Co-payments are a flag. They're proposed, they aren't introduced yet, but they're a flag for the future demise of our more equitable health system. And although $6 doesn't sound like much to the well-off, that will have an effect on the working poor, low-income earners, casual workers, working mothers, the elderly, and those with chronic health problems who can't afford to go on public benefits. Research by Professor Barbara in South Australia has shown that across Australia over 14% of people are under-servicing Medicare services, and they're the low-income people who will be affected by any introduction of co-payments. It is also worth remembering that there is a Medicare local review also going on, being overseen by one of Howard's appointees from the past, and that will report back in March, and we don't know what that's going to do to the Medicare system. Yesterday I asked my GP what he thought of co-payments, and he was scathing in his opinion of the whole exercise. Apart from the obvious inequity, he believed that payments would only cost. They'd cost doctors' administration fees. They would achieve nothing for either doctors or patients. What is even more perverse is a suggestion to extend this co-payments to emergency services as well, to try and discourage patients from resorting to hospital services when they can't afford the doctor's co-payments. Barnes' report predicts a 3% decline in GP visits if this is introduced, but it must be acknowledged that this will lead to an increase in the need for ambulance services and for emergency ward services. The whole idea is stupid repudiation of a social system built up over 100 years by the labour movement and by the social justice activists and reformers. It's a stupid exercise that just shows how out of touch with the community the Abbott government really is and his razor gang. In a country that is rapidly becoming unaffordable for ordinary people, we just have to look at the rise in housing prices in Sydney. 14% in 1 year. How unaffordable is that? Any move against the affordability of healthcare is unforgivable and highlights the battles we will face in the future as this government moves to dismantle our social services in the name of this mysterious budget deficit. We have seen Abbott's austerity measures threaten our hard-fought social justice system, and we just have to look at the attacks on legal services, particularly on Aboriginal legal services, for the most jailed people in Australia. Do we have to look at the cutting back of the funding to climate change departments when we have just experienced the hottest year in history? Then we have to look at the fact there's no housing minister, when housing affordability is a huge problem across the country. There are cuts to the CSIRO, to Tate, a review of the ABC, and the list just goes on. Abbott's mean-spirited austerity philosophy is leading Australia down a path to become the unlucky country, eating away at our social infrastructure and our safety net system. Governments are elected to provide services to the community. It is meant to provide conditions for a healthy, productive and peaceful society. It is there to create a just and fair state that governs for the good of everybody, not just for the good of the economy. Abbott's rule by reviews will see all social services face cuts by these razor gangs, and the rejection of policies made to make society more equitable, such as the mining tax and a price on carbon, are cut and dumped. So what the government must do is increase funding to hospitals, to improve the health service, universal health services for everybody, not for the elite.